victory over hard cataract. Even today, hard cataracts are the bane of the phacosurgeon. The victory chopping technique addresses the inherent surgical problems of hard cataracts. It is easy, safe, reliable, and repeatable. It amalgamates the advantages of sculpting, as in divide and conquer, and chopping, as in Nagahara's technique. Here, central sculpting is started superiorly towards the center of the nucleus of approximately 2 phacotips depth. This weakens the nucleus. The principle of downslope sculpting is employed in the final throws. Then, 1 phacotip deep trenches are made in the shape of a V on either side. This gives us a 3-dimensional vision, allowing proper estimation of the depth of the central trench. This is particularly important for hard cataracts. Now, phaco setting are changed to higher vacuum and flow rate. The central vertical ledge thus created in this technique is all important. This gives a good hole and occlusion. It gives proper visibility for embedding the tip. It also allows us to lift the nucleus away from the posterior capsule before chopping, making it safer. We now chop the nucleus by embedding the chopper into the nucleus at the capsular axis margin, bringing it towards the phacotip. And then we give lateral pressure to separate the nucleus into 2 halves. Do 90 degrees anti-clockwise rotation. The trench also allows a vertical ledge for proper occlusion and hold, and thus chopping into smaller pieces. Rotate the inferior nucleus by 180 degrees and then chop it into smaller pieces. In this technique, the variations are 1. That we start sculpting superiorly and go forwards and downwards for weakening the hard nucleus. 2. We make a V trench to further weaken the nucleus. 3. We create the all-important central ledge for good occlusion and hold for effective chopping. After routine capsular axis, hydrodissection and delineation, the central cortex is removed with the phacotip. Now, a central trench is made, which is 1 to 1.5 phacotips depth. Then, we make the side V trenches to weaken the nucleus, and thus the name victory chopping. V for victory. A routine chopper can be used to chop. As the nucleus is weakened superiorly, it may separate after lateral pressure. In some cases, we may have to physically assist in separation of the superior nucleus. After 90-degree anti-clockwise rotation, further chopping of the inferior nucleus is done. In this case, you can see how easily the nucleus can be divided into 2 hemispheres. It is most important to have a good occlusion and hold for chopping. This central ledge that has been created in this technique provides the proper platform for it. One can embed the phacotip deeper in the vertical ledge in harder cataracts, or half to 1/3 depth in grade 3 to 4 nuclear sclerotic cataracts. This case shows the removal of the nucleus pieces. The nucleus pieces are chopped in the bag. Only then are they removed. This is phacoemulsification in situ and is particularly important for hypermature cataracts. This is a case of a patient having advanced posterior polar cataract whose age is 65 years. He has been harboring this cataract since the last 55 years. Here we do a multiple gentle hydrodissection where our aim is not to detach the posterior plaque but just the cortex. This is against conventional wisdom. We also do a hydrodelineation. The use of the second hand is extremely important in posterior polar phaco, where the nucleus is not rotated too much and it is brought to the center and then chopped. The epinucleus is removed with the phaco handpiece and the plaque is eaten last. This technique of victory chopping, V for victory, is effective in all grades of hard cataracts. All the steps are safe, fast, uniform and repeatable. They take away the unwarranted and unforeseen risks of hard cataract removal. Victory chopping takes the anatomical, physical characteristics of the nucleus along with binding current nucleus removal technique. The nucleus is weakened and chopped using least amount of fluid turnover, flow rate, vacuum and phaco power, ultimately for good visual outcomes. Even hard cataracts can now be tamed